Listen, my point would be come to these clinics, visit the patients, listen to these people's stories. Let's do the right thing, close the coverage gap. There is no reason not to bring this money back to Virginia. We're paying it in. We're bringing our taxpayer dollars back. 27 states have already accepted. More are lining up. And we save our budget $1 billion. So why wouldn't you bring this back to provide health care for our 400,000 Virginians who are in desperate need? And you listen to the stories we hear today, and Gladys, who was here with us today. Why? Our job is to help people. We've paid this money in. Let's bring it home. Let's do the right thing. Keep the politics out of it. This isn't about politics. We are doing a great job in Virginia on the reforms and providing health care. But there is no argument that we have to pay our tax dollars into the federal government for this program. That decision's been made. It's been ratified and confirmed by the United States Supreme Court. Why would you not bring our hard-earned taxpayer dollars? These folks work very hard. Their taxes go in. Why wouldn't you bring it back? Give me one credible reason why we wouldn't bring our own tax dollars back to Virginia to provide health care for our citizens. I can't come up with a reason. This is our money. Why are we allowing our money to be going to our neighboring states of Maryland and West Virginia to provide health care? For folks like Gladys who live in Maryland and West Virginia, they would get coverage. They're being treated. They're being made healthier, a healthier workforce paid for by Virginia taxpayer dollars. It's so simple, so basic. And unfortunately, they've let political ideology come in to prevent this money from coming back. But as I say, where I'm working with the Republicans in the Senate, the bill that I support is sponsored by a Republican. I support it. It's bipartisan. It is literally just the Republicans in the House of Delegates. And it's just hard to fathom why we would leave our money on the table. First of all, this was another one of the many political gimmicks that the House Republicans tried. They said, let's do another audit. I think we had 63 audits, Mr. Secretary. Every day they came up with something new. Let's keep the general session going. They pulled one trick. They were all delaying tactics. This money and what we spend on health care is 20% of our budget. So how could you possibly move it out of the budget? And the reforms that the Secretary and his team have done have resulted in about $260 million in savings, $263 million in savings. Both the Senate and the House have used those health care reform savings and put them in their budget that they've proposed this year. So it's good for them to use the reform budget money, but they want to take it out of the budget negotiations. It doesn't make any common sense. It is part of our budget. It's critical to our budget. And I also, as I said earlier, I offered to take it out early on. If you cannot, to the General Assembly, if you cannot get this done and you cannot make a decision, give it to the governor to make the decision. I'll make the decision.
At Memorial Hospital of Martinsville in Henry County, we understand the power of home, knowing that Memorial Hospital brings the latest technology and the best medical professionals together for you, our families, friends, and neighbors. Right here in Martinsville, it's sometimes the best medicine. When you need cardiac care, time is critical. Our expert cardiologists are just moments away, meaning better outcomes for you and your heart. The best in care, the closeness of family and friends. That's the power of home.